Prostate-specific antigen, PSA, is a protein produced by cells of the prostate gland. A small amount of PSA is normally present in the blood. PSA is a biological marker used primarily to detect prostate cancer. Elevated PSA levels may indicate prostate cancer, benign prostatic hyperplasia, BPH, or prostatitis. PSA tests measure the concentration of PSA in the blood, typically reported in nanograms per milliliter (nang) (ml). Factors such as age, race, and certain medications can influence PSA levels. PSA velocity measures the rate of change in PSA levels in the blood over time. PSA velocity is typically quantified in nanograms per milliliter per year, (nml) year. Monitoring PSA velocity helps assess the progression of prostate-related conditions. A high PSA velocity may indicate a higher risk of prostate cancer. Regular PSA testing and velocity monitoring are crucial for early detection and management. PSA velocity is determined by measuring PSA levels at multiple time intervals. These measurements are plotted on a graph to visualize the change in PSA levels over time. The slope of the line connecting these points represents the PSA velocity. This velocity indicates the rate of change in PSA levels. PSA levels are plotted against time on a graph to monitor changes. The slope of the line on the graph indicates the rate of PSA increase. A steeper slope signifies a faster increase in PSA levels. Higher PSA velocity is indicated by a steeper slope on the graph. PSA velocity is an important indicator derived from the PSA level versus time graph. Elevated PSA velocity, or a rapid increase in PSA levels, can be an indicator of potential prostate cancer risk. PSA velocity provides crucial information for assessing the aggressiveness of prostate abnormalities. Monitoring PSA velocity helps clinicians differentiate between benign prostatic hyperplasia, BPH, and potentially cancerous conditions. Regular PSA monitoring and velocity assessment are essential components of prostate cancer screening and early detection. PSA velocity is useful in distinguishing between benign prostatic hyperplasia, BPH, and prostate cancer. Prostate cancer typically causes a faster rise in PSA levels compared to benign prostatic hyperplasia. Monitoring PSA velocity aids in the early detection and diagnosis of prostate cancer. Changes in PSA velocity over time provide valuable information for clinical decision-making.